EMRs, EHRs, they've been in the news for quite a while now. But what should you know as a patient? How does that impact your health and wallet? Let's find out. Welcome, I am the Medical Bill Whisperer. A previous billing manager turned patient advocate, I am committed to bringing answers, insights, and solutions to patients like you. EHRs and EMRs both refer to medical records. Why is this so important? Because first, it's a legal mandate that every medical service, intervention, session, visit, report, action, order, prescription, etc. must be documented in a patient's chart, and even if not during a face-to-face encounter with that patient. Those medical records must document the reason for that encounter. Was it preventive care to avoid or identify a condition early, or diagnostic to establish a diagnosis and course of action, or was it therapeutic to manage, treat, or cure that disease or condition? Both EMRs, electronic medical records, and EHRs, electronic health records, achieve this mandate. Let's start with EMRs, electronic medical records. Think of them as the electronic version of your doctor's paper chart. Those records are generated by a single medical provider to document their own actions and decisions. They are usually kept at one facility and meant for internal use. They are not accessible to other medical providers unless working in the same office or practice. They can be shared with you or other medical providers upon presentation of a signed HIPAA request. We'll get to those. There are advantages. First, legibility. Doctors' scribbles are well known, but computerized data, information, documents are so much easier to read. It makes it a breeze. Immediate use and access is also a plus. There are also disadvantages. This closed circuit can be inflexible and hard to access from outside. The additional steps to get copies of documents or information cause delays and frustrations, as they often must comply to office hours or availability of a person handling those medical records. Electronic health records, EHRs, by contrast, are a hub of records that includes your demographics, your health history, the list of other treating physicians, lists such as allergies, immunizations, prescriptions, also the tracking of your vital signs over different encounters. The advantages are many. Portability, immediate and easy sharing of medical data or documents, 24/7 access and from anywhere in the country. Clinical efficiency, such as reduction of medical errors, less duplication of services, improved use of resources. The built-in tools for prescribing medications or tests are also positive features, as can be those reminder alerts sent directly to patients for checkups or recommended immunizations or services. It has been shown that the involvement of patients increase through portals. Isn't it so easy now to make an appointment, check on doctor's notes, communicate with your physician, paying your bill, and more? There are disadvantages too. The widespread access to personal data raises questions as to who can know everything about you and your health. Some patients do not like this excessive monitoring by a system, automation being in charge, while speaking to a human becomes more and more difficult. Those systems also are prone to many data breaches and subject to design flaws, glitches, data entry errors, inter-system communication challenges, and other technical issues that can wreak havoc on the well-functioning of that whole system. Accessing your medical records will change according to whether an EMR or an EHR. But first, let's remember that a number of entities may request copies of your medical records. Beside you could be, of course, other medical providers, but also your insurance company, attorneys, for example, if you have a workers' comp claim or if you were in a car accident. The office where EMR records are kept will ask you to sign a HIPAA release form that would allow you to get a copy of your own medical file or transfer the data and documents to another medical provider or entity. They may have their own form or let you use a generic one. EHR systems offer, in contrast, immediate access to a variety of information and documentation. Your medical records, reports, test results, as well as, again, those lists of treating physicians, medications, allergies, and diagnosis codes. You do not need to provide a signed consent to gain access to those records. And other medical providers who have the same software or have electronic access will not need your signature either. Only external entities would. Now, the costs to get medical records can actually add up. No, access to your medical records is free, but the actual act of copying, mailing is not free. States can and do determine the price for those services based on the type of records, the form of media, and the need for use. For example, a page may cost a patient 15 cents, but cost $20 to a workers' comp attorney. Some states will allow a fee for labor costs, others forbid it. Do Google your own state's rules for clarification. Last, let's speak a bit about the future. It is about to bring a new type of medical and health record-keeping systems. These are SHRs, shared health records. Just as AI implementation has already become quite prevalent in the healthcare systems, we can expect the further spread of these SHR systems that link multiple healthcare organizations, enabling even larger geographical and electronic access. Just as multiple EMR records can be hubbed into a larger EHR system, many EHR systems can also be hubbed and kept under an even larger shared health record system. Advantages and disadvantages would, of course, be multiplied, but that would be the topic for another video. Thank you for watching. Your likes, comments, and subscribes help support this channel and empower more patients like you. So thank you.